Hello and welcome to Time for Health. I am Rachel Fall and I'm super glad you're here. As always, we meet with an expert on different topics and we like to share information with our public to use yourselves, share with other people if you find it useful. But as always, a disclaimer I always say is this information isn't necessarily personal medical advice for you. Be sure to always include your primary care physician on your plans and your conversations. So today we have Dr. Brad Buck. Thank you for being here.
Oh, thank you for having me. It's great to be here.
Great. You are a urologist.
Correct.
And you are kind of from the area, so tell me a little bit about yourself first.
Sure. So I was born and raised right here in Ottawa County, grew up in the Genoa-Curtis area, commuted to school in Toledo every day, so that's where I got my education. And then for college, I went to the University of Michigan in Ann Arbor, where I did a lot of research, biomedical research.
Okay.
Graduated with a biology degree.
Okay.
Originally thought I wanted to go into environmental studies, so I actually went and did a master's degree at Georgetown University in DC.
Oh, okay.
Realized that my true passion was in medicine, and then came back to Toledo for medical school.
Okay, very cool. So you're a local yokel.
Local, yep, exactly, exactly.
Okay. So went to medical school at University of Toledo?
Yep, I went to medical school at UT, and then I saw the quality of residence that we were producing out of the urology program there, so I decided to stay there for my urology residency. Very, very happy I did. It's a wonderful program. And
I guess I've never really asked this of any of the physicians, I don't think. Medical school is after college. It's 3 years of medical school?
So it's 4 years of medical school,
Okay.
and then I did 6 years of training in urology and actually also renal transplantation.
Oh, okay. So residency after that, and then you can kind of specialize like you did into different things.
Correct.
Very cool. All right. So what does the field of urology cover? I heard somebody say, you fix our leaky pipes.
Yeah, so some people classify us as, I guess, plumbers per se, since we deal with the urinary tract. So the easiest way to think of urology is really anything that the urine touches is kind of an area that we deal with. So, starting up top, the urine's made in the kidneys, so we deal with kidney stuff. It travels down these tubes called the ureters. Typically, we have one on each side, and then down to our urinary bladders. And then, of course, out through our urethra when we go to the restroom. So any kind of one of those organs or kind of adjacent organs we deal with treating. Okay.
So what's normal function? We drink a drink of water and...
Yeah, so the kidneys are really quite an extraordinary organ to start with. They really filter our bodies, so they filter our blood, they get rid of the toxic byproducts of metabolism, they get rid of nitrogen, calcium, sodium, all these kind of solutes that are in our bodies to keep us healthy. Okay. And then, the urine travels down to the bladder where it's stored until we're ready to go to the restroom.
Gotcha.
Yep.
So, we had somebody talk at the hospital not too long ago about urinary function and about waiting too long to go to the bathroom or trying to go too often and not having a sense of urgency. Like, is there a sweet spot of you should go every 2 hours or you should wait until you're about ready to burst, or what's the...
Sure. So you don't want to wait till you burst, and that can't happen, don't worry. You won't rupture your bladder. Okay. But we don't want you to hold the urine. Of course, when you feel the sensation to go, it's okay to wait maybe 10, 15, 20 minutes, especially if you're driving or something like that. But certainly you don't want to hold it too long. Okay. Normal function is if you're drinking 6 to 8 8-ounce glasses of water per day, you're taking in about 2 liters of fluid, you're going to urinate on average about 6 to 8 times a day. Okay. So that's pretty normal. Yeah.
I don't think I'm normal.
I don't drink enough water either. Yeah, me neither.
And now I did also hear something once a long time ago, and I'm so glad you're here. I can now verify this legend that I heard. But somebody had said that sometimes in car accidents, a lot of internal injuries are caused because somebody had a full bladder, and it can it rupture in an accident, and then it's your urine's floating around your body. Is that true?
So I'm not aware of any research that has directly correlated full bladders with an increased risk of bladder injury. Typically, bladder injuries occur when there's a pelvic fracture, so our bones that hold our pelvis together. Okay. There's certain attachments to the bladder, so if there is an accident and the pelvis is fractured, it can kind of kind of separate the bladder.
Gotcha.
And that's treated pretty easily, normally just with a catheter for about a week. The bladder is very forgiving, it heals very quickly.
Okay.
So yeah, but I've never heard the correlation.
Okay,
so.
thank you for setting me straight.
Yeah.
Now, you said if you're drinking 6 to 8-ounce glasses of water, a lot of people can't stand water. What are some other healthy things that we can drink to keep our urinary tract kind of functioning properly?
Sure. So of course we always recommend water, especially water with lemon in it, because lemon has a chemical called citrate, which is good for the body and prevents kidney stones. So we always say lemon, lime, water. Okay. Anything else in moderation is okay. Teas, herbal teas. The one thing that I always do caution my patients on is the consumption of coffee. So coffee has a lot of chemicals in it, and it's not the caffeine necessarily, but other chemicals also that really irritate the bladder, make it kind of hostile, make you have to go to the bathroom very frequently.
Okay.
So I see a lot of patients in that kind of area.
So water, herbal teas, and other things in moderation. What about like energy drinks? I've heard that, do they cause kidney stones, or is that, I hear all kinds of random things apparently.
Sure. I'm not aware of them causing kidney stones.
Okay.
But certainly with the level of chemicals that they're putting in those drinks, lots of caffeine, you see taurine and all that. I don't think we really know what the long-term effects on the body is of these things. So just from a general health perspective, I would caution people on kind of staying away from those.
Okay.
Yeah.
What other things can we do to kind of prevent issues, to keep ourselves healthy, besides drinking water and herbal teas and that kind of stuff?
Yeah, so healthy lifestyle, reduce stress in your life if you can. Exercise is very important. Urinary habits are much improved, as are other dimensions that I treat with healthy eating and exercise. Okay. There's a lot of research coming out now on stuff like prostate cancer, bladder cancer, and people who eat like a Mediterranean diet with more olive oils and less butters and stuff like that actually have a reduced risk of developing these cancers in the future. Okay. So exercise, healthy eating are really, really big.
I've talked to you before the show. We've done a lot of episodes, and I don't think anybody has strayed from that. A good amount of exercise, a healthy diet. You might think, how does that affect my, urinary tract? Well, it does. It's all connected, and stress and all that kind of stuff is always mentioned too.
Yeah, absolutely. Yeah, I can't harp on that enough.
Right. So those are some things that we can do to kind of prevent issues. Does part of the urinary tract, do things just break down as we age? Like there's some natural breakdown to some things? Sure.
So as we age, the renal function deteriorates a little bit, some, more in others. In a sense. We also know that as we age, our bladders become somewhat more overactive. We don't know why that is. Okay. So if you're going to the bathroom frequently, you're leaking more than you were when you were younger. It's somewhat of a normal aging process, but that doesn't mean you have to live with it. They're very treatable conditions, but those are common complaints that we deal with that we have correlated with age.
What are some of the other things that people might encounter, some of the more common issues that people come see you for?
Sure. So one of the most common things we see are urinary tract infections, a lot of kidney stones, having trouble going to the bathroom. In men, it's having to push to go, going too often, going a little bit, stopping, going a little bit more, stopping, what we call intermittency of the urinary stream. And then in women, it's overactive bladder and leakage with cough, sneezing, and laughing. Those are a lot of things we see. Also, blood in the urine we see quite a bit. Okay. So anything that is not normal function, not just regular going to the bathroom, any sort of disruption in that normal function, there's probably a treatment, or you should talk to somebody about it? Yeah, there is. Especially if you see blood in the urine, you definitely have to come see us, go to your primary care doctor. But yeah, if the symptoms are bothersome enough, we do have very effective treatments for them. You just brought up a great point. Working with somebody's primary care physician, do you need to have a referral, or can somebody call you directly, or should they go through their primary care doc? Yeah, I mean, we always recommend going through the primary care doctor if they can. They can always call my office directly. That's not a problem. Some insurances will require a referral placed by a primary care physician, though.
Sure. A lot of it's determined by the insurance.
It can be, yeah. Yep.
But it wouldn't hurt to call your office, that's fine. And if you do figure out it needs a referral, they can go back and get a referral from their doctor.
Absolutely. You know, my office staff is wonderful. We're always more than happy to help. So just go ahead and give us a call. That's never an issue.
Okay, great. So out of all those conditions that you mentioned before, the things that are problems that they can talk to you about, what would you say the most common is? Did you say urinary tract infections first?
Probably urinary tract infections.
Okay.
I do see quite a bit of that, especially chronic ones that are just, you know, they're usually in women. They're usually, you know, very frequent, especially as we age.
Okay. What are some of the symptoms of a urinary tract infection?
Symptoms of urinary tract infection would be going to the bathroom more frequently than you typically do and burning with urination. Sometimes you can have a little bit of discomfort around the pelvic area also.
Okay. So that's something that, and is that the same in men and women, the signs?
It is.
Okay.
But a man should never get a urinary tract infection.
Okay.
So if you've had a urinary tract infection and you're a man, you should really come see a urologist.
Okay.
Yeah.
Awesome. So that's one of the most common ones. I think what we're going to do, we're going to take a quick break,
Great.
and then we'll come back and talk about a few more, and we'll be right back.
Perfect.
And we're back. We're talking about urology, healthy function, not healthy function with Dr. Brad Buck. You talked about urinary tract infections being probably one of the most common things that you see, and in women, not necessarily in men.
Yeah, correct. So a man, like we were saying, should never really ever have a urinary tract infection in his life.
Okay.
That would be abnormal.
Okay.
But in women, because the urethra, the urinary channel that we go through the bathroom through, is so much shorter, the bacteria have a lot easier way getting in.
Gotcha.
So,
and some of the symptoms to watch for: the pain, burning, frequency.
correct.
Okay. All right.
And even a little bit of blood in the urine sometimes.
Okay.
So.
And that's something that can be pretty easily treatable, sounds like.
Easily treatable, but especially if you're having recurrent infections, you know, we want to use antibiotics when we have to, but if we can prevent rather than, you know, be proactive rather than reactive.
Gotcha.
So I like to treat a lot of my female patients with chronic urinary tract infections with stuff like cranberry pills and vaginal estrogen creams and stuff like this. So
I was going to ask you about that. Cranberry juice, that's something else I hear, but it actually, I'm on that one. Okay.
Yeah, there's actually some evidence that it does help prevent infections, especially with certain strains of bacteria. And cranberry pills too, they're a little more potent, and there's not a lot of sugar like there is in the juice. So sometimes we'll recommend for calorie reasons the pills rather than the juice.
Gotcha. Yeah. Okay. What are some of the other conditions that you see sometimes?
We see a lot of kidney stones too.
Those are terribly painful, I hear.
Terribly painful, yeah. A lot of women that I see say they're worse than giving birth, actually.
That's
so
pretty bad.
They're very painful. Yeah.
So what is there a cause? It's not energy drinks, like I thought, or one of the causes. But what are some possible causes of kidney stones? Yeah,
so we talk about the most common causes in the United States as being dehydration, actually, so not drinking enough. So if you think about kidney stones, they're crystals, right? So if we can dilute the urine by drinking more water, crystals cannot form. So dehydration is the most common cause. Second most common cause is usually either not enough citrate in your urine. Citrate is that chemical we talked about that's in lemons and limes.
Okay.
It actually binds the calcium, which stones are made of, and so it can't crystallize out of solution and form the stones. And then we also talk about too much calcium in the urine, which is sometimes the cause also.
So like, don't drink so much milk calcium, or not necessarily?
Interesting you bring that up, actually. So we've done epidemiological studies where we've looked at whole populations, and if people actually reduce their calcium intake, they form more stones, not less stones. Oh. So actually calcium intake is very important for kidney stone formers. It's not bad, it's actually protective.
Okay. See, we learn something every time we do this. So kidney stones. What do you, is there medicine you can take for those, or is that some people have to have surgery?
Yeah, so certain stones we can actually dissolve with medications.
Okay.
Those are stones like uric acid stones. Actually, we can dissolve those pretty readily by giving citrate. Again, another chemical we've talked about a lot. Calcium stones we cannot dissolve. So if you have stones, sometimes you can pass them on your own, but other times you do need surgical intervention.
Okay. All right. And is the surgery pretty intense, or is it an outpatient thing, or does it vary maybe depending on how serious?
It does vary somewhat, but I'd say 95 to 96% of our surgeries are outpatient for kidney stones. Very minimally invasive, much different than it was, 10 or 15 years ago even. So we've got very small little cameras that can get into all the little areas of the kidney and take care of all those stones for you.
Gotcha. It's amazing what they can do.
It's wild. Yeah.
Okay, so UTIs, kidney stones, what's something else that you see a lot of?
A lot of urinary incontinence, so leakage of urine.
Okay. And what causes that? I mean, it probably could be all kinds of things.
Yeah, so we talked about the coffee already. The coffee's
Enough
very
about that.
Yeah, I know. So really we break up urinary incontinence into 3 broad classifications.
Okay.
So if you're leaking urine, it can be because your bladder's overactive. It's just contracting when you don't want it to contract.
Okay.
That's what we call overactive bladder or urge incontinence.
Okay.
Now, if you're leaking when you cough, sneeze, and laugh, that's different. That's from support of the pelvic floor.
Okay.
And that's treated, like I said, differently. And then there's some people who have a bladder that just defunctionalized and is not working anymore. So their bladder gets so full and then it can't hold anymore and they'll leak. We call that overflow incontinence.
Okay.
And each one of those is treated very differently.
Sure.
So while they have the same symptoms, the treatments are just radically different.
And so overactive or incontinence, that was the issue. So the sign or symptom of that would just be somebody who's leaking or feels like they have to go all the time.
Yep. So the typical questions I ask my patients are, they'll come to me, they'll say, I'm leaking urine. I say, okay, well, do you feel like you have to go to the bathroom and you can't get there in time? And they're like, yes, that's exactly it. And I'm like, well, that's urge incontinence.
Okay.
Or I say, are you leaking when you cough, sneeze, and laugh? And they say, yes, that's what's going on. I say, well, that's stress incontinence.
Okay.
And so based on the history that we discuss and that I take, we can usually narrow it down to what exactly is going on and then offer treatments going forward.
Okay. So it's a lot of it is just sitting down and knowing the questions to ask, and that's kind of what you've been trained to do, is know to ask the questions to figure out which kind of whatever is going on.
Exactly. And sometimes I don't know,
Sure.
So we have to do a secondary testing by testing the bladder function itself.
Gotcha.
But that's pretty rare.
Do you do to figure things out like x-rays or MRIs or anything like that, or? X-rays probably.
For overactive bladder, we have what we call Urodynamics, and Urodynamics is a very what's the word I'm looking for? Fancy machine. Yes, thank you. So we actually measure the bladder function. We can measure the pressure within inside the bladder. And stuff like that. So it allows me to see, is the bladder overactive, is it underactive?
Gotcha.
When the patient is leaking, how much is their bladder pushing, which makes me kind of decide, what's going on essentially.
Gotcha. Okay.
But for x-rays and MRIs, not x-rays so much.
Yeah.
For kidney stones, absolutely, but not for overactive bladder. MRIs, sometimes we will need an MRI of the pelvis.
Okay.
But that's few and far between.
Okay.
Yeah.
I don't know if this is one thing you're going to bring up, but it's something I wanted to ask about, and I'm pretty sure you deal with the area of prostate enlargement, prostate cancer. Can you talk a little bit about that? The recommendations have changed, and
yeah, absolutely. So usually for prostate cancer screening, I'm a urologist, so I belong to a committee called the American Board of Urology, or the American Urological Association, and they have recommendations that say that men should potentially be screened for prostate cancer between the ages of 55 and 70, with a greater than 10-year life expectancy also. So that's what I propose, is that between 55 and 70. And if you have a family history, we actually start sooner sometimes.
A little bit sooner.
And it's just done by a simple blood test called a PSA measurement.
Okay. And then is some prostate enlargement sort of normal, or is prostate cancer a slow thing, a fast thing? Does it vary?
Sure. So prostate enlargement is very common as we age.
Okay.
So symptoms of having to push to go to the bathroom and going a little bit stopping, go a little bit stopping, waking up at night, these are typically not signs of prostate cancer. This is just signs of the prostate enlarging.
Okay.
With prostate cancer, the prostate doesn't typically enlarge. It just has cancer within it. So usually symptoms of prostate cancer, the most common symptom of prostate cancer that we see is no symptoms at all, actually.
Gotcha.
So that's why it's important to get screened and checked with the PSA.
Gotcha. I kind of thought prostate enlargement was a sign of prostate cancer, but they're kind of two different.
Yeah, they're actually, if you look at the prostate, you kind of think of it as like an apple, and the core is the area that we urinate through, that men urinate through. The prostate enlargement occurs around that core area in the center of the prostate. The cancer is on the outside, so if it's on the outside, it's not pushing on that channel, which is where the symptoms come from. Exactly.
Gotcha. Okay. Other conditions that you see? We talked about UTI, kidney stones.
Yeah, so we treat a lot of blood in the urine. Unfortunately, I do see some kidney cancers, some bladder cancers. Okay. We treat testis cancer, penile cancers. Okay. A lot of these things.
And do you work when you're dealing with any of those cancers, you work in conjunction with an oncologist probably, and a primary care physician, and a whole team of people probably?
We do, yeah. It's really a multidisciplinary approach, absolutely, 100%.
Okay. All right.
Yeah.
Other kinds of conditions, common things that you see?
We see some pelvic floor dysfunction where the muscles don't relax to let the urine out, so we see that quite a bit. But those are really the most common ones that I think we see in men. Sometimes we see a condition called prostatitis. Prostatitis is an inflammation of the prostate. It causes those same symptoms we were talking about, burning with urination and going to the bathroom frequently. And sometimes with just an extended antibiotic course, we can treat that pretty easily. I treat a lot of erectile dysfunction in men too. Low testosterone I treat. So all these things are really in our wheelhouse. I mean, we see them every day.
So if somebody, hypothetically, gets up to go to the bathroom multiple times at night, is that a sign of an issue, or is it a sign of maybe they should stop drinking water?
So I see
so close to bedtime.
I see that a lot. It's a term we call nocturia. Nocturia means waking up at night to go to the bathroom. It's one of the largest complaints that I see in my clinic. And so the recommendations for that I tell every patient is, don't drink water after 7 or 8 o'clock at night, because anything you put in is going to come out at night. If you have any swelling in your legs, you want to get your legs up before you go to bed, because that swelling when you get into bed is going to drain to the kidneys, and then you're going to make that urine at night. Also, sleep apnea. If you snore at night, it puts a lot of stress on your heart. It causes your heart to release a chemical that goes to your kidneys and makes you make a lot of urine at night. So actually, nocturia is one of the most common signs of obstructive sleep apnea that we see.
Really?
Yeah, it's pretty interesting.
That's a unthought of combination there.
Yes, I know. When I tell patients, they think I'm absolutely crazy, but I promise you the research is there to back it up. And then there's actually a condition, we don't know really why it happens, but it's called nocturnal polyuria, which is a long term that basically means you just make too much urine at night. And then there's a pill, sometimes a little nasal spray we can give you that stops that from happening. And we do that by doing avoiding diary, which is we have you keep track of when you go to the bathroom, how much you go, and there's certain things I look at to make that diagnosis. So
when you said if somebody has an issue about going to the bathroom and it's annoying when you have to go at night, what's a normal time for if I drink my last glass of water? Like, what's a normal time that it should be leaving my body? Yeah, usually within an hour or two. Okay. So if you go to bed at 10, we say nothing after 7 or 8, just to give you a little bit of extra. I am long asleep by 10, so I got to cut it off a lot earlier than that. You and I both. Okay. All right. We are about to be finished. Are there any last thoughts or comments or anything you wanted to cover that I didn't get to? Well, I just wanted to thank you for inviting me to be here, and just wanted to let everybody know that we have a lot of really effective treatments, minimally invasive things, medications, stuff that you've probably never even dreamt or thought of, using lasers and bladder stimulators and all these just
great things that really help people. We've really brought the most up-to-date urologic care to the Port Clinton area and the surrounding area also, and certainly we want to continue to offer the absolute best for the community here.
Thank you.
You're welcome.
All right. We're going to take another break and we'll be right back. And we're back. I want to thank Dr. Buck for being with us today, learning a lot about our urologic function, putting to bed a lot of myths that I had heard over the years, and learned a great deal about signs and symptoms and all the different things that they can do. So hopefully this was useful information for you, or maybe somebody that you know that you can share it with. We'll put up on the screen the phone number to reach Dr. Buck's office if you have questions. And hopefully, again, this was useful information for you. And until we meet again, please make time for health.